So for the last case of the day, of the session, I would like to invite Dr. Laxmi Tuli KAUSHAL. She's going to talk about case series of subretinal cysticercosis, cause and outcome.
Good morning, everyone. I'm going to present a case series of intraocular cysticercosis, course and outcome. Cysticercosis, as we all know, is a parasitic infection caused by Taenia solium. The disability-adjusted life years of this disease could be as high as 1.73. Ocular cysticercosis has a varied presentation. Most frequently, it involves the ocular adnexa, followed by the posterior segment. Human infestation, as is commonly known, is linked to the consumption of undercooked pork. My aim is to report the clinical presentation and surgical intervention for intraocular cysticercosis done at the medical college in North India over a period of 5 years. This is a case series, retrospective case series of 7 cases of subretinal cysticercosis. All patients were males aged between 7 to 65 years. And 4 out of 7 belonged to urban areas, and only 3 belonged to the semi-urban or rural part of the country. Surprisingly, 5 out of these 7 patients were vegetarian, and in all the cases, pars plana vitrectomy with the cyst removal was done. Outcome parameters were defined as anatomical success was defined as attached retina with normal intraocular pressure with or without medication at final follow-up, and functional success was defined if the visual acuity was more than 6/60. Clinical presentation of decrease in vision was found in all the cases, accompanied with pain, redness in 2, floaters in 2, flashes and lymphedema in 2 and 1 cases. All the cases had vitritis. All the 7 cases had vitritis. Interior segment inflammation was found in 4 cases. The cyst location was submacular in 3 cases. Extramacular in 2, and in 2 cases it was intravitreal. Mean presenting visual acuity was logMAR 1.36 and mean final visual acuity was 0.8. Anatomical success was achieved in all the cases, while functional success could be achieved in 70% of the cases. This is the summary of all the cases. I'll be discussing 2 out of these. This is the case of a 7-year-old male who presented to our OPD with the preoperative visual acuity of logMAR 1.78 with the large submacular subretinal cyst, on which on OCT scan was a multiloculated cyst, and was operated upon with the pars plana vitrectomy with cyst removal, and had a poor visual gain due to massive subretinal scarring. This is another case of a 16-year-old boy who had this submacular cyst with macular hole. On OCT vertical scan, the cyst could be seen intending to escape through the macular hole. So he was immediately operated upon, and he had a good visual, post-operated visual acuity was 0.78. And on this histopathology, cysticercus was confirmed. On MRI brain, this patient had a disseminated neurocysticercosis. I'll come into the discussion part. The cysticercosis, as is commonly known to be affected in non-vegetarian and rural population, but this can be there in vegetarians and urban populations, as reported in our study. Poor hygienic condition, unwashed salads, raw vegetables could be the main source. Ours is a referral center, so subretinal cases were more in our study, as intravitreal cases so could have been operated at other centers. So in conclusion, we can say that cysticercosis can affect non-pork eaters in vegetarian population. In endemic country like ours, a high index of suspicion for cysticercosis is required in endemic areas for a prompt diagnosis. Ancillary tests like OCT and radiological investigations clinch the diagnosis, and early intervention is must to get the good results. Thank you.
What do you want to convey actually?
We want to say, as everyone say, that most of the people, if we talk about cysticercus, they think about that must be having seen in rural population or in pork eaters, undercooked pork eaters. But in our series, it was found to be more common in urban population and in this vegetarian population as well. So there should be high index of suspicion in all the cases. They should be taken as equal, vegetarian, non-vegetarians.
So what was the aim of your study? That's what I wanted to know. What was the aim of the study? Why you are conducting? Why are you presenting this? What are you wanting to highlight from this paper? Ki, rural and urban population
Rather
can
than
get
vegetarian
affected.
population, yes, sir.
That was the aim of the
Yes,
study.
sir.
So I would agree. The only thing was that the population was vegetarian. Rest everything I think
Yes,
is
sir.
very known. Thank you.
And do you start albendazole in these kind of patients? When do you start albendazole with steroids in
After,
these patients?
yes, sir. Yes, sir. They were started on albendazole after medicine consultations.